Okay, guys, so today we are going to be talking about different skin disorders that we have in horses. So let me share here. Okay, so skin disorders. So in general, so the skin is the largest organ that we have in the body, right? So let me put myself up there. That we have in the body. And then in general, we have to think about the time of the year. If the horse is itching, if how the lesions look, if they're all similar, if they're all different, if there is crust, scales, loss of hair, one location, multiple locations, is this an injury, or what exactly is going on? The field of dermatology is a very difficult field in humans, animals, etc. And the reason for that is because a lot of things all look alike. Okay, so and dermatologists need to know the differentials for each of the diseases so they can collect the sample according to what may be. Okay, so there is many different kinds of skin disorders. Let me see. Mange, okay, so that's a parasite. Malassezia, that's a fungus. Seborrhea is just when the skin is too oily or too dry. There's different types of seborrhea. Pemphigus is an autoimmune disease. Papilloma, that is a virus, papillomavirus. As we all know, it affects different animals. Sarcoid is a type of tumor, etc. Okay, so we just have so many different things that can happen to the skin, and so different diseases that all may look alike. Okay, so we're going to start out with talking about papillomavirus. I'm going to be giving like a virus, fungus, bacteria, and then allergies. Okay, so that's what we're going to be talking about. So papillomavirus is a virus that causes warts, and it is the type of virus that everybody has. There is human papillomavirus. There's different types. In cattle, you have them also, and they are proliferative. They're viruses. And they're caused by the Equus cabala. So even though other species have also papillomavirus, each one is species specific. Okay, so it's unlikely that if you touch the one in horses, that is going to pass to you. But when horses touch other horses that are also immunocompromised, it may pass to them. Most horses are young. We already have been talking about why it is that diseases may affect younger horses than older horses because of the level of stress. This is the time of their lives when they get pulled from the pasture or whatnot and start being trained. So that's why their immune system lowers down a little bit. Okay, there's no gender or breed predilection. It can be spread by fomites or close contact. The warts will spontaneously appear and spontaneously disappear after a few months. So there's different types of different things that we can do to try to treat the disease. However, if you don't do anything, they also disappear. The clinical findings is going to be warts generally on the muzzle, lips, sometimes in the ears, the eyes, genitalia, lower limbs, etc. So they are little warts that look like cauliflowers. Okay, and these lesions are very obvious because it's a lot of them. Sometimes they may look like sarcoids depending on the location, which treatment is going to be totally different for sarcoids and papillomavirus, because sarcoids don't generally disappear, they just continue to increase. So, and this is why I say here, sometimes cutaneous biopsy to differentiate from sarcoids. Sarcoids, not necessarily young horses are going to have it. Like I said, papillomavirus will spontaneously resolve, okay? So it's difficult to know if the therapy, if any type of therapy that you're going to be using, it is actually working. Now, some horses, if, let's say, for example, thoroughbreds, if they're going to go to sales as yearlings and they are full of papillomaviruses, that's aesthetically unpleasing to the eyes, okay? So they need to not have the papillomaviruses. So the treatment is generally done for aesthetic reasons, okay? So people can actually cut the warts, you can freeze the warts, so cut would be a surgical excision. You can do chemical cauterizations with silver, freezing warts is with nitrogen. You can try immunostimulants to try to increase the immune response of the horse so the horse himself can take care of those viruses. Affected horses should be isolated, and you should disinfect the premises that the horse was and not share fomites, okay? So these are just photos of horses that have papillomaviruses. Sometimes, depending on the horse, they may have just a few of them, and sometimes it can be more covered, like in the ears, etc. So that's it for papillomaviruses. You just need to be careful that it is differentiated between that and sarcoid, but generally the veterinarian will have an idea. Dermatophilosis, okay? It is what we call rain rot, okay? Rain rot, as we all know, is these lesions that happen in on the skin of the horse in times where there's a lot of rain and this horse stays wet all the time, okay? It is a bacteria that's called Dermatophilosis congolensis, okay? That's why dermatophilosis, derma, obviously dermatologist has to do with skin. It is facultative and aerobic, so it can live in the presence or absence of oxygen, but prefers lack of oxygen, and shares characteristics between fungi and bacteria. So a lot of the times people thought it was fungus, and now it's decided it is a bacteria. No one knows what the natural habitat is, but it shows up in the horse. Maybe the skin of the horse, it's already living there. And then when the environment becomes too rainy, too much rain, horse not being groomed, not getting a chance to be dry, and then when the skin is too wet, it becomes more easy to cut. So because it becomes more flexible and more moist, so then any kind of little lesion can become the area where that bacteria is going to proliferate. So cut crusts from infected animal can infect the same animal in a different spot or other animals. So this is why when the horse is too wet, has been raining, which here in Kentucky happens all the time, raining. It's very important that when grooming the horse, if he's still wet, or even if he isn't, if he has already dried, but the skin is still moist, to not use that metal curry, because that can actually do mini lesions in these horses, and that can be the area where the bacteria will start to make the lesions. The other thing too is that even an insect bite can be the initial lesion that will lead to the bacteria taking over the skin of the horse. So again, establishment of the infection is going to depend on the virulence of that particular strain of bacteria that the horse is having at the time. The health of the horse. Horses that are healthy, a lot of the times, a lot of horses get wet at the same time, and just a few are going to develop rain rot as opposed to the other ones, okay? These hyphae are going to penetrate the skin, and it's going to break down the skin, and is going to form crusts and infect new areas. So this goes under the skin, like I said, because it also is a facultative anaerobic bacteria. It breaks the keratin, and these bacteria are okay in a wide range of pH. So washing it with acids and basic doesn't really kill this bacteria, and it can survive in inflamed skin. Like, remember when it forms pus, and pus is acidic, it doesn't matter, it likes to live in that type of environment. This bacteria is unable to infect intact skin. So that's why horses that are healthy, that don't have little lesions in their skin, but it's very hard to find a horse that has 0 lesions, because they scratch their backs on trees, and that can cause mini lesions that we are not even seeing, okay? Insects, ticks, bites, they will cause these lesions that are enough to cause the disease to set in the horse. Okay. Also, more moisture. The rain is going to increase blood-sucking flies. It creates, and this is the other thing that's important about a lot of rain, especially in the winter and spring, because the horse has so much hair at that point that it creates an anaerobic environment with the matted hair, with the hair coat of the horse and the amount of rain on top. It creates that dense and anaerobic environment underneath the hairs. So that's why grooming these horses and allowing them to dry is the best way to prevent this disease. These lesions are exudative, meaning they release a little bit of pus. The hairs are matted together and they're going to form thick crusts. When these crusts are removed, the underlying skin is going to be eroded, it's going to be red, and it's going to, it hurts, okay, the horses. And it can even bleed, it's going to be painful, it's purulent and just nasty. Okay, so generally, because it is where the rain generally are, is going to be on the croup of the horse, on the back of the horse. Horses that have a low back, like a sway back, water just puddles on them, so they're going to have this disease there as well. Diagnosis, you can do cytology, and clinical signs. It's pretty easy to see this disease. Here's the thing. This disease, when it starts, it's purulent and inflamed and nasty. And then if it goes without treatment, it just becomes very dry. Okay, as you can see, the horse has alopecia, so it loses all the hair. So this, as you can see, is just a new kind of lesion, but if you leave it be without any treatment, it will become nasty, and it's nasty for the horse. So here's one of the things that let me see if, one of the things that is important to do this is when we find this, a lot of the times we just go to town and start to try to pick all this crust from the horse. It hurts the horse, okay? So the best thing to do, number one, to prevent is to keep the animal dry. And then being kept dry, and you can treat with different things, generally the horse will recuperate. Okay, sometimes you may need to administer antibiotics if the horse is not responding to the topical treatment. There is different types of topical treatments that you can use. If using shampoos, okay, you just need to remember that for shampoos to work and any kind of disinfectants to work, you need to leave them on for 15 minutes because it's the time of contact that the bacteria have with whatever disinfectant is what's going to kill it. Okay, so it needs to be on for 15 minutes. Don't excessively scrub, because as you're scrubbing too much, it may create, you may personally create more lesions, and you may create more pain for this horse. Just try to form that foam and wash the horse entirely and leave the shampoo on for 15 minutes. Other things that you can do too is like the betadine scrub, because these bacteria are susceptible to betadine, iodine, kinetic products. They have wonderful products that are shampoos and sprays that you can use. Ketoconazole spray, you can use that too. You can use a variety of things. You can also get betadine, and you can dilute it in a spray bottle and just spray the horse, and never rinse, and that will kill the bacteria. MTG is a wonderful product. It has sulfur, and sulfur is what kills the bacteria. It's an oily product. You just need to be careful that if you're going to put MTG on the whole back of the horse, that it's not super hot outside, the sun is not 100 degrees, because it's oil. You will effectively fry the back of the horse and make the inflammation even worse. Okay, so MTG is great. MTG on the legs is great, even on the rump and on the back of the horse, just making sure that you are scrubbing it in and making sure that the sun is not too hot, so you don't burn the horse. And then, because MTG is oily, the next day all this crust will easily come off. Okay, and then you can remove the ones that have easily come off, as opposed to like excessively trying to remove all the scrubs. Okay, don't share grooming tools. Insect repellent is important because insect bites can be the source of the little lesion. And if when you groom your horse routinely, you allow this air to actually go and to the skin, and this bacteria doesn't love oxygen. Okay, so this, as you can see, the little lesions, skin is actually the little scales of crust. The lesions, the skin is actually removed with the hair. So the little things, the little lesions actually look like little brushes, okay, with the little skin and the hair coming off. Okay, so just be careful to not remove all the skins, but keeping the animal dry is important. Okay, so that is for rain rot. Now the next one is called dermatophytosis. Phytosis, it has to do with fungus. Okay, this is what we call ringworm. Ringworm is actually a fungal disease, even though it's called worm. It's highly contagious, direct or indirect contact. You all know what that is. Girths, a lot of the time, these horses are going to have lesions on the girth area. And girths can actually pass the disease from one horse to another horse. A lot of diseases that may look like dermatophytosis, that is actually the fungus, can be something different, okay? But they may look alike. Stress, because any fungal disease, stress and low immunity is going to predispose the animal to developing that, okay? So it's important for you all to understand that these diseases, fungal diseases, virals like papillomaviruses, when the animal is being stressed, he doesn't have a good immune system to actually get rid of the disease a lot. So it's important to keep these horses as stress-free as possible. Sometimes it's not possible because you're having to start these horses in training, etc. Okay? Some horses will develop the disease just once and never develop it again. A lot of the times, this disease can form as a little, I hate this thing, as a little circular area. So very perfect round circles with erythema, meaning redness, scaling of the skin, alopecia, which means loss of hair. And it can also have urticaria-like lesions in the beginning stages of the disease. Urticaria is hives, and we're going to see here in a second. Okay, girth, shoulder are the most common areas to have this. If you're treating with other things and this is not working, you may need to actually go further diagnostics. A lot of skin diseases come and go away with minimum treatment, but if you just increase the immune system of the horse, it may just fight it off. Sometimes if it doesn't, you have to do different diagnostics to try to figure out what is going on with this horse. So as you guys can see, this is like in the ear region of the horse, halters, rubbing, then halter gets contaminated, and then you pass one halter to the other horse, and that's how they can contaminate other horse. You can see it's little round, little lesions everywhere. It starts out as round, as you can see here, round lesions everywhere. And then as they get together, you can see as the lesions get together, okay, they will form bigger lesions like this, especially in the girth area, etc. Just for fun, one time my horse had one like right on her face, and I've been putting medicine on it. I just do betadine because this particular fungus responds really well to iodine. And I did this, and somehow I also itched my armpit. And guess what? Guess who? So this is one of the diseases that can actually pass to people. Mange can pass to people. This can pass to people. And I scratched and itched my armpit. And a week later, guess who has a red, perfectly round lesion on their armpit? Okay. So it's just important that you wash your hands or wear gloves when dealing with this disease. So like I said, most cases resolve spontaneously. There's multiple topical products that you can use. Betadine, lime sulfur dip, ketoconazole shampoos. If you're going to do the ketoconazole, the shampoos, you have to leave it on for 15 minutes. So it has residual effect, but it's not the best. So you can do the ketoconazole shampoo and then chlorhexidine spray on it. As a matter of fact, for dermatophilosis, the rain rod, I said ketoconazole, I meant chlorhexidine spray from Kinetic, not ketoconazole. Ketoconazole treats fungi, not bacteria, okay? Environment, all horses that share the space with infected horse should be sprayed, okay? Because maybe their lesions haven't started yet, but they may start, and you can bleach the premises and tack. So depending on the tack, you're not gonna bleach your expensive leather saddle, okay? But maybe hopefully you can actually use disinfectants in the girths, or not share girths, not share saddle pads, etc. And again, can be contagious to humans, okay? Then the last disease that we're gonna talk about that is skin type of disease is allergies. So urticaria or hives. Urticaria or hives also comes and goes as soon, it comes fast. It can also go away fast as soon as whatever injurious thing is removed. When the horse is removed from whatever is hurting him, it can go as fast as it came, okay? Maybe exogenous, so that's why I say often develop and disappear suddenly. Maybe exogenous, so something that is outside, meaning insect bites and the horse is highly allergic to that, or a weed or something that the horse scrubbed himself and now it broke off on his skin. Or it can be endogenous. Endogenous meaning something that the horse ate and he's allergic to, and now it broke out in hives, okay? Already talked about that. Also can be by inhalation, okay, of allergens. So a lot of the times in the spring, horses can develop urticaria hives semi-often, okay? May be associated with intestinal parasites. So there are certain intestinal parasites that predispose the horse to become more allergic to things. If you guys remember when we were talking about different inflammation, one of the granulocytes was responsible for allergies, okay? And they were responsible for, or they increased in numbers when the horse was heavily parasitized with intestinal worms, okay? So that's the reason why. You have to differentiate, because these certain diseases can start as urticaria in the beginning, such as pemphigus and ringworm, but if it comes and goes quickly, it may just be urticaria, but you just need to figure out if something is not improving, if the treatment is not improving for urticaria, it may be something else. Plaques will appear quickly, okay? In severe cases, and this is the problem with this, the horse can be so allergic that his muzzle can start to swell, his eyes can start to swell, and he can actually close, he can have asphyxia. So in certain cases, it's just the horse has it, you remove him from the outside, you fly spray him, or you bathe him first to remove anything that he touched, fly spray him, or maybe it's a new feed and you don't feed it anymore, and the lesions go away. But in some cases, it's very, very severe, and the horse needs to receive treatment, okay? Sometimes they can have fever, anorexia, dullness. They can become too excited because everything itches, and they can become too excited and restless. What else? Any part of the body can have that. In severe cases, you can find everywhere. Oops, hold on. Let me make my dog stop barking. Hold on. Okay, hopefully I figured that out. Let's see. The skin lesions are going to be round, things. They can be small and a ton of them. They can be big and a ton of them. It's just going to depend how the horse is responding or how much of whatever is causing him allergy he got in contact with. Okay. In general, the prognosis is favorable. Fatalities are rare, but if it happens, it's because of anaphylaxis, and the horse will die of asphyxia. How do we treat? So acute urticaria usually disappears spontaneously, but if it's not, dexamethasone is the very quickly and the best treatment available. Antihistamines such as Benadryl probably doesn't work as well in horses as it works in us. If the horse is suffering anaphylactic shock, he has to receive epinephrine to open up his airways. And the lesions are going to disappear fast, but they can return just as fast if the allergen is not eliminated. Okay, so look at these horses. So you can see this. It's not as severe. It's just a few lesions, okay? But look at this guy here, how severely allergic he is. When something is like this, when it's this severe, it's an emergency, okay, guys? You need to, if you don't have Dex at hand, injectable, you need to call the veterinarian to come and give that before this becomes worse and the horse has an anaphylactic shock. So this is what I wanted to talk to you about skin lesions and skin diseases, is that most of them look very similar, and it's important they come and go. And if they're not coming and going and it's something that is persisting for longer, the veterinarian needs to come over to take a look, do some certain diagnostic techniques to figure out what's going on. So like pemphigus foliaceus is an autoimmune disease that has to be treated with steroids, so dexamethasone, and it's something that the prognosis is not as favorable as, for example, the other disease that we talked about. Okay, I will, if you have any questions, don't hesitate to email me.